para magpagamot. So, nakita ng government yon. So, para hindi lahat tatakbo ng Manila, ang ginawa, in-empower ang mga hospitals in Visayas, hospitals in Mindanao, and far-flung areas of Luzon. Each of these were identified, and each of these cancer hospitals are being equipped at present time to be able to first diagnose and subsequently to treat the cancers. So, hindi na dapat tayo matakot doon sa magpatingin kasi wala akong perang panggamot, because knowing that it is a devastating disease financially, devastating to the finances of the family, ginawa na ng paraan yung gamutan. And these cancer centers all over the Philippines, sila yung sagot for the people na hindi nila kaya ang gamutan.
Let's talk about about the cancer centers or testing centers facilities, no? Do we have enough of them, or where can we look for them? I mean, kasi Doc, let's face it, no, sabihin ng ibang tao, may mga specific areas na madami na yan. But there are also far-flung areas of the provinces, like let's say in far reach of Tacloban, minsan may mga walang road access doon eh. And there are a lot of people who are very sick there na encounter ko rin when I do my rounds as a journalist. Where can we get tested and treated?
At the moment, the plans, the government facilities that have been earmarked have devolved into the major cities of the Visayas and Mindanao. We do have a cancer center that's coming up in Tacloban. Then we have the one in Cebu, in Iloilo, in Davao, in Cotabato, in Cagayan de Oro, Zamboanga. These are the cancer centers that are going to be equipped with the linear accelerators. This will provide radiation therapy to our patients, as well as some of the important diagnostic equipment that would be needed for the proper diagnosis and staging of the disease.
There will also be CT scans company that those radiation facilities. And aside from that, the government has, with the PhilHealth, have already done those Z package programs, especially for breast cancer and colorectal, and we're actually working on the lung cancer for the next one. For breast cancer, from surgery to chemotherapy and radiation, that will be no balance billing, so they don't have to pay anything for that. The same way for colorectal cancer, colon or rectum. It's constantly evolving, and we're trying to expand to all those areas where we have the top mortality in cancer. Now, we also have for a long time already the medicine access program that we started a long time ago. We have the breast cancer medicine access program where we can give patients free chemotherapy all the way, early breast cancers. Also, we have the program also for leukemia. So leukemia has its own access program. So we do not have to stop sa diagnosis after knowing some people, ay may cancer ako. Kasi ibang doctors din kasi pagka nasabi na, naku may cancer ka, tatanungin naman ng pasyente, ano pong bawal sa akin? Ay wala nang bawal sa'yo, kumain ka na ng kumain. Kasi the attitude is, maiksi na lang ang buhay mo, may bawal pa. Hindi, gawin mo na lahat ng gusto mong gawin. Kumain ka na yung gusto mo, kahit lechon, araw-araw kumain ka, parang gano'n. So they give up so easily on these patients. But no, right now we have a lot of resources to help patients. So hindi na ganon na we just stop. Actually, even now, there's an ongoing hospice bill also for those terminally ill patients. So even at the terminal illness, meron pa rin tayo, there's something that we can offer for patients. So we cannot stop at any stage of these diseases.
Yes, and I understand, Doc, kasi there are a lot of treatment options, no? And so I'd like to talk about that, such as, for one, immunotherapy, and how is it different from other treatments, such as, let's say, chemotherapy and targeted therapy?
Now, for a long time, since 1990s, there has been studies on the tumor environment and how our immune system relates to it. I remember that convention we had in Greece na pinresent lahat yung nangyayari sa tumor environment and how our immune system kasi ang nangyari hindi ma-recognize ng ating immune system, particularly yung ating pang-defense ng pagkain, kasi pag every time na may abnormal cell or merong invader sa ating katawan, automatic yung immune system natin has to take it out. Talagang tatanggalin yan. That is the normal way of our body. It's wonderful system, very complex. Pero ang problema, bakit itong cancer, abnormal na nga siya, pero hindi pa rin siya nakita ng immune system. So now, as we saw in the AVP kanina, we found out about the PDL1. The PDL1, I explain it in the layman's term is, para yung kumot, natatago niya yung cancer cells from the immune system kaya hindi nakikita. So now, nakagawa na ng paraan para matanggal itong kumot na ito na pinaproduce ng cancer cells para makapagtago siya. Nakita na siya ngayon ng immune system natin. And now, it gets to be actively involved na tanggalin yung tumor. So now, we are looking at an era na katulad ng sinasabi kasi ng mga nasa alternative medicine, naku, pagka nagpa-chemotherapy ka, mamamatay yung mga good cells mo. Kasi pag pinatay yung bad cells, kasama yung good cells na mamamatay. Now, we are telling them, iba ito. Pag binigay namin ito, tuturuan ito ng immune system mo na lumaban doon sa cancer na hindi pinapatay yung iyong immune system. So, ito yung malaking pagbabago in the way we treat cancer right now.
Given what you explained, Doc, I'd like to ask, ano yan ang impact on survival? Yung key questions like regular people like me would ask, diba? Magpa-immunotherapy ako, so chemo has been explained to others already. What is the impact now on survival?
First of all, gusto ko lang explain na iba-ibang stage ng cancer, iba-iba ang gamot. In the same way na iba-ibang klase ng cancer, iba-ibang gamot. So hindi mo pwedeng sabihin, isang gamot lang, kaya lahat ng sakit na yan. Hindi po ganun yon, okay? And immunotherapy at present time, ang role niya is basically in stage 4 cancers. So, yung evidence na meron po tayo ngayon, nagpaggamit ng immunotherapy, ay yung dun sa mga advanced stages na. The one particular example is that of melanoma. Yung melanoma, isa po siyang klase ng skin cancer. Yung parang mga kulugo na nagkakaroon ng mga pagbabago, nagiging skin cancer sila. So melanoma, dati, meron kami tinatawag na 5-year survival rate. So when you say 5-year survival rate, ito yung chance ng isang tao dun sa stage ng yon na mabubuhay siya in 5 years time. So for example, kung ang sinabi ko ang survival rate ng melanoma na stage 4 is 5%, that means 5% out of 100 will be alive at the end of 5 years. But with the studies now on immunotherapy, that 5% survival rate has been increased to 40% in stage 4 melanoma patients. So instead of saying namin ngayon na ang melanoma na na-diagnose na stage 4 ay not curable, now it seems like we're finding a cure kasi ang taas na ng survival from 5% to 40%. So in the other cancers, ganun din na nangyayari ngayon. The cancers that used to be diagnosed sa stage 4, kunwari 6 months lang ang survival rate, pwede na silang humahaba ang buhay with the advent of new treatments.
Siyempre po, an important question, di ba? And to help the person with cancer make a good and sound decision, ang sasabihin ng mga tao sa paligid niya or yung mga family members, siyempre ang importante, if may cancer, kunyari, daddy ko, mami ko, komportable sila. That's why I'd like to ask, what kind of quality of life would I get if I at it or decided to go through with immunotherapy?
Yes, particularly in the advanced stages of the disease, may hugot line tayo na what is the reason to extend life if there is no life in the life? Diba let me rewrite. You have to add not only years to life but life to years. What is the value of adding life if there's no life to years? These new treatments in the advanced stage of the disease has opened the possibility of less toxicity with better impact on efficacy. And this gives the patient an opportunity to live a meaningful life. So that 5% to 40% in a melanoma patient, we would be able to see that this patient is enjoying life, is doing activities of daily living. And this is very important in the survivors because that's true. There may be other aspects in the related to getting these treatments, not limited to the diagnostic tests, the companion diagnostics, to the cost of medicines. But what is most important to the patient is the quality of life that he gets by having his life extended.
So, ibig sabihin lang, yung nakikita na sa telenovela na napapanood nyo na nangingitim yung mata, nagsusuka at nakakalbo at lahat na ng nararamdaman tungkol dun sa chemotherapy niya kasi pwedeng totoo babagsak yung immune system kaya yung white blood cells bumabagsak. Pwedeng magkaroon ng infection, baka yun pa nga ang ikamatay ng pasyente. Ito yung mga na-avoid natin sa immunotherapy kasi hindi na nga ganoon ang impact sa ang side effect na nakukuha ng mga pasyente. Hindi na yung nasusuka at nakakalbo and everything. Kaya yun, sinabi ni Dr. Tutut, maganda yung quality of life ng pasyente. Ibig sabihin, mas tolerable na. It has hindi naman siya devoid of any other side effects. So, meron siyang ibang side effects. Although very minimal, masyado nang na-outweigh ng benefit yung mga side effects na iyon. Kaya nga, itong immunotherapy, kaagad na naaprubahan ng FDA. Kasi napakalaki ng advantage na nakikita. Hindi lumayo na tayo ngayon doon sa nakikitang chemotherapy.
And Joey mentioned about FDA. Kasi po, just want to give caution na marami na rin po talagang mga ibang centers or mga individuals na nagbebenta ng kanilang mga gamot daw or alternative meds as we call them at sinasabing yun ay immunotherapy. Very important sa sinabi ni Dr. Joey, FDA approved. So yun po yung trabaho rin ng government. The Food and Drug Administration makes sure that the drugs that get into the market, given to the people, the Filipino people, are safe and effective. So yun po yung parang seal, yung mark ninyo, na yung totoong nagtatanggap nyo na sinasabing immunotherapy ng kung sino man na nagagamot sa inyo, ay totoong immunotherapy. Hanapin nyo po yung seal ng government na FDA approved siya. And it is not given right and left. As I've mentioned, iba-iba pong klase ng cancer, iba-iba pong klase ng gamot. At iba-ibang stage ng cancer, iba-iba rin po ng style ng gamutan. Pwede kung early stage ka, baka surgery lang naman ang kailangan mo. Kung medyo advanced ka ng konti, stage 2, 3, baka may surgery, may konting chemotherapy pa. Or combined chemo and radiation. Or later on, kung mga advanced stage, may kasamang radiotherapy pa. Yun yung sinasabi ni Dr. Lola kanina, na multidisciplinary team approach. So, dapat, kung gusto mo na immunotherapy, you go to the right doctor. And these are usually administered by the medical oncologists who really study how to give it properly. The drugs that are FDA approved, they have been tested and meselyado ng FDA na talagang pwede silang gamitin sa pasyente.
Talking about how do we then give access now to Filipinos to this approved immunotherapy treatments or drugs? What are the plans that the government has?
At present time, the drugs that are in the market are still expensive, admittedly. Okay. Wala pa kami dun sa talks about treating stage 4 cancers. Nandun lang kami sa palliation. So, unfortunately, our government is not that rich yet to be able to administer these medicines. But if you go to your medical oncologist, we have what we call clinical trials. So, our medical oncologists are equipped already in the sense that naka-partner na po kami sa mga international organizations that allow us to use these drugs in the clinical research setting. So sometimes they can be given for free if done in the context of clinical research.
Thank you, Doctor. And of course, I'd like to share now and to show all of you what we've already done against lung cancer. Please focus your attention on the screen to watch a video presentation which recaps the activities we had last year.
A part of this movement called Hope from Within,
Yes, that's right.
and this advocates for test, talk, and take action for lung cancer. Based on your experience, tell us about that.
When Dad was diagnosed, there were little choices. It's either give him long life, but admittedly poor quality, or let him live out whatever is diagnosed, but good quality of life. Two choices. Now there's a third option. And if you get, and I suggest, stand up to your parents if they're, if you're scared of them, stand up, get them tested right away. And then, who knows, this drug or whatever, this treatment, immunotherapy, could work and give you longer. Could you imagine my dad had 4 years?
Yeah.
He was given 4 months. And there was no immunotherapy, I think, yet at the time. So, what more with this new treatment?
Okay.
But you have to get tested right away. Don't be scared of it.
Yeah.
How do we battle lung cancer? Ano po yung gusto itaguyod ng inyong organisasyon kumbaga?
So mayroon kaming advocacy, ang pangalan niya ay Test, Talk, Take Action. So importante yung mga pasyente na mayroong symptoms, magpatingin sila sa doktor nila para mag-gawin sila ng test. Yung test na dapat tama para sa kanilang nararamdaman upang masuri natin mabuti kung anong cause ng cancer nila. At para ma-determine din kung ano yung tamang paggamot. Because there are many types of therapies now available for the lung cancer patient. And before, it used to be parang a death sentence. Parang pag meron kang lung cancer, siguradong mamatay ka na.
I mean, what were the things that you learned from that? Looking back, you knew what the symptoms were as a family. And what you learned from the doctors, could have it been caught earlier? Could you have been quitting earlier?
My mom and I were constantly talking about Dad's cough, and he said, I think he has cancer, but I don't know how to tell him. And then she told me, why don't you talk to him and drag him for a test? Finally, during Holy Week, I remember that the cough was getting worse. And then he said, Dad, when we get back, I promised to do some of the things he wanted me to do. I will do that. In exchange, just go for a biopsy.
Describe your journey with your father after he was diagnosed.
Well, he was a fighter and he wanted to live. He really wanted to live badly. I think he was scared of leaving us behind. He said that we weren't ready to live without him. And of course, he was saying that as a joke. But he was very disciplined in everything he did, from trips to the doctor to watching what he ate.
Okay, so that also had to change.
Yeah, everything changed to his prayer life. And he listened for